Donald Trump may be trying to force the nation's focus towards violence and crime, but a new poll finds the majority of people are a lot more worried about the pandemic than anything else, with 78% saying they're still concerned. And with growing reason. Over the past few days, we've seen an alarming series of headlines about the coronavirus, with the U.S. nearing 185,000 deaths and topping 6 million cases, more than 25,000 of which are on college campuses, which are continuing to open. Then we get word the FDA would be willing to fast-track a vaccine to the public without finishing full safety trials. We're seeing op-eds from the former director of the NIH telling us we need to start ignoring the CDC after they declared asymptomatic people need not be tested, contrary to every other expert who's trying to contain the virus. And somehow the president still thinks natural herd immunity might be a good way to go too, meaning we just let the virus take its course.
We use the word herd, right? Once you get to a certain number, it's going to go away. So, it doesn't have to be, but yeah.
But yeah, just so we're clear, managing to survive this virus doesn't mean you're good to go after that. We've heard countless reports of people dealing with serious complications many months after infection. So where'd the president get his latest bottle of snake oil? Reportedly from his newest medical advisor, former neuroradiologist Dr. Scott Atlas, a guy who's also argued that children cannot spread the virus and apparently doesn't believe in masks.
There's certain data that's very controversial about masks. I don't want to make fun of people who say these other things, though, and the reality is it's stemming from a massive amount of fear, bordering on hysteria now.
That's apparently advice Trump has taken to heart, too, as evidenced by how he started that roundtable in Kenosha yesterday.
If you feel more comfortable, you'll say a couple of words. You might want to take the masks off. Otherwise, you can leave them on. Either way you want. Look how fast you took that off.
My God. But of course, with or without dubious advice, denial is a specialty of this president, as we saw in this tweet over the weekend, in which he shared a post that Twitter later deleted, claiming that the CDC said only 9,000 people have actually died from coronavirus in the U.S. because all the other reported deaths also listed other pre-existing conditions. Thankfully, we have people like Dr. Anthony Fauci to explain how wrong that is.
That does not mean that someone who has hypertension or diabetes who dies of COVID didn't die of COVID-19. They did. So the numbers that you've been hearing, the 180,000 plus deaths, are real deaths from COVID-19. Let there not be any confusion about that. It's not 9,000 deaths from COVID-19. It's 180 plus thousand deaths.
I'm joined now by another man we should all be thankful for every time we see him on TV, although I'm sad to say he recently took his talents from Cambridge to Providence. The new dean of Brown University School of Public Health, Dr. Ashish Jha. Congratulations on the new job, Doctor.
Thank you. Thank you.
So there is also one piece of news I didn't get into the introduction. This is a lead story on the New York Times website. COVID-19 update. States should prepare for possible vaccine by early November, CDC says, which I assume is just an extension of the FDA, as I said, saying the other day, Han, even if we can't finish the test, we may put it out for the public before we're done. Does that concern you?
It does. It does. I mean, just any document that says we should be ready for a vaccine, sure, out of context, that's not unreasonable. We should always be ready. But the bottom line is that there is context here. And the context is that the FDA chief has said openly that he doesn't have to listen to his own advisory committee and may choose not to, and has said openly that 2 weeks before the election, he is prepared to authorize the vaccine without completing trials. This is not subtle. This is not reading tea leaves. This is what he said. And then put the CDC document on top of that. And I think a lot of us are very concerned that we're rushing this here. We're not going to let the science do its part. It's true that one other country has done this, Russia. But that's not the model we want to follow. We want to follow the scientific model that the FDA has been so good at for so long.
So when you hear things like that, I assume you're not surprised when you read numbers as high as I've read 40% of people say they wouldn't take a vaccine, even if government approved and free. You tie that to leaders of the FDA and CDC, let me be unkind and say, cooking the books. When someone approaches you and say, why should I trust any of these people to tell me the truth? What do you say to them?
I mean, first of all, Jim, I have to be honest, it just breaks my heart because we have an incredible scientific community, great scientists at the CDC, great scientists at the FDA, toiling away, doing God's work, and doing it really well. I trust them. The problem is that the political leaders of these agencies have not let their scientists speak, not let the American people benefit from the knowledge. And so it's tough. And of course, vaccine hesitancy is out there even without COVID. And this is going to make this worse if we don't follow the scientific protocols that are essential to making sure vaccines are safe and effective.
Can we stay on the topic of snake oil? The president's new Rasputin, it appears, is this Dr. Atlas, who appears to be a pusher of this herd immunity, I assume a la Sweden. Is there a credible person in the public health community who thinks we should just go for it, let everybody get infected? I assume, you'll correct me if I'm wrong, maybe a couple of million people die. Does anybody support this other than Atlas and maybe Donald Trump?
Yeah, so look, Dr. Scott Atlas, I'm sure he's a lovely man, is a neuroradiologist, has no background in public health, no background in infectious diseases, no background in outbreaks, any of this stuff. This idea that we should just go for herd immunity is a terrible one, not for the least of reasons that you mentioned, which is we're going to have millions of Americans dead, maybe 5 or 10 times as many people as have died already, tens of millions of people potentially disabled. We've never done this with any other infectious disease. We've never tried this approach for a good reason. It's a terrible approach. So short answer is no. I don't know anyone in the public health community who thinks this is a particularly good idea.
Can we stay on terrible ideas just for a second, if we can? I was thinking of you yesterday out of the blue. I'm watching one of these grotesque, sadistic videos where some individual is in the face of an employee, I think it was at a Walmart, who was just trying to do her job, saying, sir, please put on your mask, please put it. He is as close to her as my finger is to my nose. When you see those things on television and they're relentless, what do you feel? What do you think? What do you say?
So first of all, my first and foremost reaction is for that employee. I mean, this is why we have seen so many people that we have deemed essential workers get sick and die during this pandemic, is that these people are putting themselves out on the front lines. And as a society, we're not protecting them and we're not offering them enough security. That behavior is incredibly damaging. It's much worse than if somebody smoked and kind of blew smoke in your face. They're potentially coughing a deadly virus into you. And we've got to find mechanisms to stop it. That stuff really frustrates and angers me because it's unnecessary, it's harmful, we should do better.
It's also not very kind to one's fellow man. You know, probably the way this is coming closest to home to real people is parents having to make decisions about schools. We've had leaders of the teachers' unions and parents on the show. As you know, there's unanimity amongst the teachers' unions in Massachusetts that the K through 12 school year should start all remote. Here's just one example. The president of the Massachusetts chapter of the American Federation of Teachers, Beth Contos. We miss our students terribly. We all wish we could be back in the classroom with them. But it's become clear in the last few weeks that an in-person return to school would unacceptably put the health and safety of our students, their families, and educators at risk. Charlie Baker disagrees, and from what I understand, you too disagree. Is that correct, Doctor?
Yeah, I'm very sympathetic to the fear that a lot of teachers feel. But I think, with all due respect to Ms. Contos, her assessment of the health dangers are not consistent with what most health experts think. Most health experts believe, and I certainly believe, that in Massachusetts, now not in Georgia, not in Mississippi, but in Massachusetts, we can get most kids back to school safely. We can get it safely for them, safely for the teachers, safely for the other staff. And not easily. We got to do some work, but we can do it. And I think that if we are going to say that we believe in expertise and rely on science and evidence, that goes for everybody. And I do think that we've got to let science and evidence drive us here. And if there is fear, we should figure out what the fear is, and we work to address it. I'm very sympathetic to teachers on this issue. I think we can make it safe for them and for students. That's what we got to do.
When you say some work, what is the some work that needs to be done to get to that place?
I'll tell you, I'm watching private schools across the state open up because they've done the work, because their business model requires it. There's no reason public schools could not have been doing this. So what could they do? We've got to make sure that windows open in all the buildings so that we can get fresh air in. We've got to make some accommodations and improvements on ventilation. A lot of private schools are opening up outdoor school space for the months of September and October. No reason public schools can't do that. That kind of stuff. And of course, we have to have mandatory mask wearing for teachers and children. If we do all of that with the level of community transmission we have in Massachusetts, I think we can get K through 5 back in most places full-time, all the kids. And then probably for older kids, maybe a bit more of a staggered or more of a hybrid approach.
Doctor, can we return to where we started, vaccines, for a minute? One of the other stories in the last 24 hours is an announcement by the Trump administration that the WHO, World Health Organization, linked effort to collaborate scores and scores of countries around the world on manufacture and distribution of vaccine is not an effort that we will be part of. Should Americans be concerned by that decision, or can we proceed just fine on our own?
No. This is the classic, penny wise, pound foolish, short-sighted, bad for America approach. Let me explain why. First of all, not all Americans are going to get the vaccine. I expect 20, 30, 40% of Americans will end up opting out. So even if we get high levels of population immunity, we'll still have lots of people who are susceptible. And then if the large parts of the world remain susceptible and infected, if we have any international travel at all, if any country starts letting us in, if we start letting people from other countries in, we're going to start seeing outbreaks again in the United States. The way we get through this pandemic is when everybody gets vaccinated around the world. It's a global pandemic. We can't build walls high enough to keep everybody else out and ourselves locked in. That's called a prison. We don't want to make America a prison. If we want America to be part of the globe, we've got to help other countries and be part of a global solution.
Well, the global solution, as I say, includes putting together a formula for distribution. And the minute we have remaining, who will decide and who should decide who gets the vaccine once it's ready?
So America is going to decide for itself, and I understand that. The nice part of this international effort was that it wouldn't necessarily in any way take away from our own internal efforts. But what it would
what is our own effort? How will we decide in this country who gets it and when they get it?
We're waiting there's a couple of advisory committees. They're working on recommendations. I think we're going to be seeing them in the days and weeks to come. There was some set released yesterday. My guess is as these all come out, we're going to have healthcare workers first, high-risk people next, and then everybody else after. But we're going to have to see what those recommendations are in the days and weeks ahead.
I only have 20 seconds. You seem unconcerned about that issue, and I've been obsessed with it. Is my obsession misplaced?
I'll tell you, Jim, there have been plenty of times I've been surprised. I have not worried about it. You're right. Partly because the people working on it are really terrific. And I am hopeful that we will have a good plan. We will have it so that there won't be financial barriers. But maybe my hope is misplaced. God knows it's been dashed on multiple occasions in the past. So I hope I'm right and you're wrong on this, and that the distribution approach goes well.
Speaking of dashing hope before you go, the restaurants in Cambridge are far better than the restaurants in Providence, but good luck anyway. Dr. Ashish Jha, it's a pleasure as always talking to you. Thanks for your time.
Always fun. Thanks, Jim.